Live. I'm Lindsay Crane, and I head the content and community teams at Undivided. With me today, we welcome back a power duo, Undivided's public benefits specialist, Lisa Concoff Kronbeck, and our director of health plan advocacy, Lobel. Not only are they beacons of knowledge, they're also parents of children with disabilities. So they intimately understand the emotions and the necessities around what they do. So welcome, Leslie and Lisa.
Thank you.
Hey, ladies. So some of the major government programs that can help pay for medical visits, therapies, durable medical equipment, services, and more are Medi-Cal, Regional Center, and CCS. So that's where we're going to focus today. So before we jump into specifics, Lisa, I'd love for you to give an overview and confirm who is eligible for each so our families know what's actually available to them. And let's start with Medi-Cal. So
Okay.
Lisa, who's eligible and what can it provide?
So for Medi-Cal, there's, for our purposes in this discussion, there's two primary ways that people are going to qualify, maybe three. One is by family income, by modified adjusted gross income. One is if the child is receiving SSI. And the third is if you don't get—
Oh, and SSI, just in case somebody doesn't know what that means.
Supplemental security income. It's a benefit from the Social Security Administration for people with disabilities. And the third one is if you don't qualify by any of the financial thresholds, you can, if your child is a regional center client, you can also qualify for the Medi-Cal institutional deeming waiver for people with developmental disabilities. And your child can enroll in Medi-Cal without regard to family income.
Is it all ages?
A lot of times once our kids turn 18, they qualify for Medi-Cal based on income because they no longer consider parental income. So for regional center, most of the time you're going to see kids on the waiver. That's not always the case, but most of the time. For SSI, that's going to be all ages. And for modified adjusted gross income, that's also going to be all ages. And then—
Oh no, I was going to ask about the two different plans of Medi-Cal, but
okay. We're really getting in. Okay. So Medi-Cal there's two kind of different ways of delivery. The first is fee for service, which is where you can go to any provider who accepts Medi-Cal through fee for service, and they swipe your benefits card, and Medi-Cal will cover depending on what your primary insurance, your private insurance situation is. The other and more dominant method of delivery is managed care at this point. Managed care is HMO, basically. Each county has choices of different plans, and you go to providers within that network. If you have to go out of network, you need referrals, and there has to be exceptions. But generally speaking, you're going to be within the network. And we can talk later about who is in fee for service and who is in managed care. But those are the two basic types.
And just a clarification, depending on which plan that you choose for Medi-Cal, does one work with other funding sources differently? So if you pick a managed care plan, does that work differently with insurance than straight Medi-Cal?
So they're generally going to operate similarly, but not identically with private insurance. Things go a little bit differently with CCS. But with private insurance, I mean, again, or I guess for the first time this week, the major issue is that your provider has to contract with the form of Medi-Cal that you have. So if you have a doctor who is a fee-for-service provider but is not contracted with a plan, and you have a managed care plan, that's going to be a disconnect. So it's going to work similarly in the sense that your private insurance is always going to pay first, but it's going to always depend on who your provider is contracted with.
So that's where the focus is, obviously. Find out where your provider is, and that's
yes,
a leading factor. And does Medi-Cal cover out-of-network providers?
No, if your provider needs to be contracted with Medi-Cal. There are some times when you can get a single case agreement, depending on the provider and the situation, whether there is an in-network provider, a contracted provider who can offer the service, but they need to be a Medi-Cal contracted provider in order to bill Medi-Cal.
And we did have one just quick follow-up about SSI. Lisa wanted to know, how does a child qualify for SSI?
That's going to be income-based. I mean, it's going to be disability-based, but also they're going to look at family income.
Do you, and just off the top of your head, do you remember the threshold?
Not offhand, yeah. Because it's kind of tied to the federal poverty level, but it varies by family size and it changes every year.
And then regional center. So,
It's a regional center.
overview. Yeah, who qualifies
okay.
and what is that?
So that's going to be, we're going to talk mostly about kids who are over age 3. So that's going to be kids who have a diagnosed or adults who have a diagnosed developmental disability and have significant impairments in at least 3 of the designated areas, which include things like independence and the ability to manage their own finances, ability to like social, emotional, just general developmental areas, ability to work. There's a whole bunch of them, and you have to have deficits in at least 3 areas within that. Self-care, a lot of them are adaptive skills, so the ability to care for themselves and live independently.
And there are more details. I know I think she just shared our Regional Center 101 article that we worked on with Lisa, and that will go into
and they're all listed out there.
Yeah, but just to clarify, Lisa, and Regional Center covers birth to death for the qualifying conditions, with a different though, for early start for the 0 to 3 has a bigger coverage area than after 3.
Yes, it does. There are situations where you may need to get qualified under Lanterman before age 3, but generally speaking, 0 to 3 is for children who are at risk of developmental delay. There are certain automatic qualifiers, but it's going to be children who are at risk, but they don't always have a diagnosis. And then there's also a new provisional status for kids who continue to have developmental delays, but don't have a formal diagnosis. For kids who are 3 and 4, and then they'll be reassessed at age 5. That's new.
Great. And you might have already said this, but if I missed it, and I think the golden phrase to always remember about Regional Center is they're the payer of
last resort. Yeah. Payer of last resort. Always going to come last. Always, always, always.
And so lastly, for the overview, CCS, who is eligible? Because a lot of times CCS comes up and parents are like, what's that? What is that? So what is that and who is eligible?
So CCS is California Children's Services. It is strictly medical. So there's a lot of overlap between regional center eligibility and CCS, but eligibility for one does not convey or infer eligibility for the other, because there are a lot of conditions that are CCS eligible, but not regional center eligible, and vice versa. So it's going to be strictly medically based. There's a whole long list of diagnoses and disorders of various bodily systems, and they explain which conditions are eligible.
And just for like 3 of the major ones, right? Isn't it like CP, cerebral palsy?
CP, severe gastrointestinal issues, lung issues, heart issues, cancer, hearing impairments. There's just like I said, there's a whole
just to give
list.
people an idea, because
musculoskeletal conditions like like muscular dystrophy, spina bifida, like there's
autism is not covered under CCS. Correct.
I mean, it's not covered. If a child has autism and a significant medical condition, they're not going to rule them out because they also have autism. But the need for CCS has to derive from the CCS eligible condition.
All right. So this is, very brief, right? Because we, we'll definitely, we have events on each of these, but we wanted to give, that really brief overview of who these, programs affect. So let's look into some scenarios now. So let's take a family who has private insurance, Medi-Cal, and regional center. So who pays first? I mean, is there a general funding order that families should understand? Leslie, you want to start off with this one?
Okay.
Sure. Thank you. When a family is using multiple funding sources, there is definitely a specific order of operations that parents should be aware of and should definitely follow. Lisa hit on it a little bit earlier, but the general mantra is private insurance always pays first. So the order of operations is private insurance, then Medi-Cal, and finally regional center, which you alluded to, self-identifies as the payer of last resort. So what that means is they're going to require written proof of denial of all other pertinent funding sources before they'll consider a funding request. So don't even go to regional center until you have all your other nice packet of written denials all lined up like ducks in a row.
So I'm going to ask an annoying question because I know you said this is the general order, but does that order depend on any kind of circumstances, or is that that's reliable, right? Insurance, Medi-Cal, regional center. That's pretty much what parents can rely on, right? And then what about CCS? So if we throw that in, Lisa, how does that keep that order, or does that throw that?
Yes and no, and all over the place. So there's a lot of coordination between CCS and Medi-Cal happens behind the scenes. Like sometimes you don't even know about it. But if you have CCS kind of operates as a case manager. And so it'll go to your private insurance, and then it'll go to CCS, and CCS will review it. And if it's something that Medi-Cal will pay for, then Medi-Cal will pay for it. And if it's not something Medi-Cal will pay for, then it goes back to CCS. An example is hearing aids. Medi-Cal has a hearing aid cost cap. And so, and that price cap generally is not going to cover the kind of complex devices that young kids require. And so CCS will review it. If what they need is covered within Medi-Cal, then Medi-Cal will pay for it. If not, then it's going to go back to CCS. Sometimes CCS will deny something because it wasn't reviewed by a CCS doctor, or because they know that Medi-Cal will pay for it. So they'll say, no, this is Medi-Cal. But yeah, so it's like, it's private insurance, CCS, Medi-Cal, CCS, regional center.
Right. Always knowing that, you can have
like a traffic cop.
Yeah,
right?
And there are some exceptions in different counties, because some counties have tried to kind of streamline their delivery of CCS and Medi-Cal. And there's also some exceptions if you have managed care versus fee for service. But generally speaking, that's the order. Okay.
What's an example of CCS yes and Medi-Cal no?
Like specific hearing aids would be an example. Like I said, Medi-Cal has
right.
they cover hearing aids, but only up to a cap. And a lot of hearing aids are more expensive than that, especially pediatric hearing aids. And so that would be a CCS yes, Medi-Cal no.
Got it. Okay. Then many families are confused about when and how they can use Medi-Cal and their insurance together. Very common, right? So if a family's chosen provider takes their private insurance and Medi-Cal, can you give an example of where they would each pay a portion of that visit and or services? Leslie, you want to start with this one?
Sure, thanks. ABA is a great example to use here. If you're seeking services for ABA with a provider that accepts your primary insurance and is also contracted with the specific type of Medi-Cal that you have, either fee for service or managed care, and if managed care, they're associated with the program in your county that you have elected for your child, then the combination of those two funding sources will absolve you of all payment. In fact, the provider for ABA or any service that is contracted with both your private insurance and your particular source of Medi-Cal is obligated to and must accept those two combined funding sources as payment in full if both of the funding sources approve the treatment.
Okay, so just to clarify, so if you're using both sources of funding and they're both approved, right? It's an approved procedure or service, then you have to pay nothing out of pocket. You should not have to pay anything. If you're using insurance and Medi-Cal, they've both approved something, the family should pay nothing out of pocket.
Yeah, the provider is obligated by virtue of their contracts. They're obligated to accept that payment from both sources as payment in full. Except, I'll give you, because there's always an exception, right? An exception that I'll highlight here is if you're going to a durable medical equipment provider for a major piece of equipment, Medi-Cal or CCS and insurance together will meet your funding, except for certain items that are not determined to be medically necessary. A good example is some accessories, say for a wheelchair, like a cup holder or some specialty wheels. you and I may consider a cup holder as an essential item on a wheelchair, but your insurance plan is not going to. And it's the durable medical equipment's providers' responsibility as they're compiling your order to let you know any items that are not going to be covered. So if you want your kid to have those great looking wheels to sport, or you want a dedicated space for your iced latte, even if you have approval from both Medi-Cal and from your health plan, those items are just not going to be covered if they're not medically necessary, and you'll be out of pocket there.
So I'm going to jump in and say that this is actually, for both examples that Leslie gave, this is actually a really good example of where the regional center will jump in. Because for the example of ABA, if you have a managed care plan, ABA is covered through managed care regardless of diagnosis if it's necessary. But a lot of private insurance companies will not cover ABA if the child does not have a diagnosis of autism. And again, managed care Medi-Cal will do that, but the ABA companies don't contract with fee-for-service Medi-Cal. And so if you have private insurance that's denied ABA because your child doesn't have autism, but you have a referral because your child needs ABA, the next funding source is going to be the regional center, because Medi-Cal, fee-for-service Medi-Cal doesn't cover it. And this is all going to change next year. So we'll talk about that later. But for right now, the regional center is going to provide ABA for kids who can't get it through private insurance or Medi-Cal. The other example that Leslie gave is kind of accessories on a wheelchair. If those accessories are medically necessary and the insurance and Medi-Cal won't fund them, sometimes the regional center will be able to fund those additional items. For example, a sunshade for the wheelchair. If your child is sensitive to heat, or they have dysautonomia and can't regulate their body temperature, and you can document that with a letter of medical necessity from the doctor, the regional center may be able to help you fund those additional costs. And I'll just throw this in. I don't know how applicable it is across the board, but some DME companies, if you have to pay for something out of pocket, may give you a discount if they contract with your private insurance. Right. So that's also something to ask for if you can't get it funded by regional center, and even if you can. I mean, if you have to pay through anything besides the insurance, they might be willing to give a discount. So just be aware of that as well.
How about getting a car seat for a large kid approved as medically necessary? Have people done this? It's a safety issue, but not sure if it's medical.
If it's an issue of being able to be safe in transport and transport into your community and transport to medical appointments or anywhere that a child needs to go, if they have an issue with maintaining correct posture to be safe, then definitely it can be covered. It could be appealed or be covered or pre-authorized with the health plan first.
I would agree that
if insurance,
at least one of those funding sources should jump in, because if it is medically necessary, I mean, if your child can't get to doctor's appointments, or even an adult, like not everybody's able to maintain an upright position. And a shoulder strap doesn't cut it for a lot of our kids. They need a 5-point harness.
In fact, I had a personal situation where I got a new wheelchair for my daughter, and the health plan did not want to pay for tie downs. They did not want to pay for that wheelchair to be safe and be anchored in an adaptable van. And that was an appeal that I won, because it was this, I couldn't push her in her chair to every medical appointment. So it's an arguable and winnable thing with the correct documentation from a medical physician to establish that. And a cover letter full of outrage is always helpful too.
Sure, that would not be hard to muster in that situation, right?
Yeah, and I would add that it's always going to be about medical necessity and not convenience. So like if you need like something to like carry things for your child and it's medically related, like if there's an oxygen tank or machinery, that's a different argument from like I need somewhere to put my purse or I need somewhere to put my coffee cup.
Right. Exactly.
To our earlier example.
Yeah.
Right.
And so will Medi-Cal pay insurance copays?
So I'm not really sure how they do it behind the scenes, but generally speaking, Medi-Cal is going to pay whatever the private insurance doesn't cover, up to the Medi-Cal reimbursable rate. And then you're not supposed to be billed for anything on top of that. There are certain situations through Medi-Cal where there may be a copay. But generally speaking, when you're dealing with the private insurance and Medi-Cal together, Medi-Cal is going to pay the remainder of what the insurance will pay up to the Medi-Cal rate.
What
You
about,
shouldn't see additional out-of-pocket expenses.
Including deductible.
that's what I was going to ask. What about, will Medi-Cal pay private insurance deductibles?
It's if it's an out-of-pocket expense that you would be expected to pay, then Medi-Cal should be paying it. If it's medically necessary and if the provider contracts with Medi-Cal and all of that, like.
Okay, can I ask a layperson question then? So if, your deductible, beginning of the year, here, here's your deductible. So then you have to be going to a provider who takes your insurance and Medi-Cal to get that deductible, obviously. So maybe we should try to target specialists if they take both up, so that, and then that means that your deductible is paid off, right? Like, I mean, if they're paying it, it isn't like, well, Medi-Cal paid this, we're just going to like tack it on to the end, Leslie. Like that's, if it's
Right.
paid by Medi-Cal with a visit or two, then.
Right. It's really an advanced user of their insurance. A savvy user could definitely plan what time of year they want to do certain things, bulk load things to the beginning of the year. Or if you're a family that doesn't have Medi-Cal for whatever reason, you'll want to bulk load something expensive towards the end of the year when you've met your deductible somewhere else, right? So it really becomes, once you have the basics down, you can sort of do some of that chess playing. I would also add, if anybody's feeling uncertain about having Medi-Cal cover their deductible, as desirable as seems, if they're feeling there's some awkwardness or they're not sure they want to tap into that, I would encourage them to, because my understanding of the reasoning behind it is that the government is doing that in order to encourage families to keep their private insurance, in order to make it easier to carry private insurance so that Medi-Cal doesn't become the sole funding source for all of the services and equipment and necessities for the child. So please, if you're feeling any hesitation, get over it and take advantage of what's offered to you. Or at least be fully aware, even if you have discomfort, that that's an option that's available to you. And that's the reasoning behind it.
I also feel like there needs to be an article out of this, Leslie, right? How to plan your visits throughout the year. Not that anything's guaranteed, but those are some amazing tips. And we have a lot of parent questions coming in. The first was, if I have copay assistance through regional center, does it go away once I get Medi-Cal? Lisa?
So it depends on the provider. It's not going to go away because you got Medi-Cal. What's going to happen is the regional center is going to want to know if the provider is a Medi-Cal provider. And if they're not, then they may continue to pay the copay as long as the service is in the IPP. But they're not going to pay the copay if you have Medi-Cal and it's a Medi-Cal provider.
Sherry has a really good question, and I hear this really frequently from parents. She said, my private insurance keeps sending letters asking if my son has other insurance. He has straight Medi-Cal, so how do I answer that? Some said if we share that, they might try to get his care covered by Medi-Cal first. Lisa?
They can't. I mean, you can let them know that you have Medi-Cal. Medi-Cal is never, if you have private primary insurance, Medi-Cal is never going to come before that. Your private insurance is always going to be primary over Medi-Cal. If you have 5 insurance plans, you somehow wind up with 5 insurance plans, Medi-Cal will always be the last one. Mm-hmm. And so it should not impact your private coverage or to let them know that you have Medi-Cal.
Some plans are so interested in getting that, what they call coordination of benefits question answered, that they will actually pause processing your claims until you answer their prompt to answer that question.
Crystal, she asked, my son has autism and qualified for OT at school, but school said he probably needs medical OT too. Medical said he didn't qualify. So Kaiser said he didn't qualify. Can I take Kaiser's denial and ask regional center to cover OT? We don't have Medi-Cal. We're working on it.
Generally speaking, regional center is going to defer to the school district for those services from age 3 to 17. The regional center for medical therapies, they're still going to defer to the school district. And it gets complicated. First of all, the regional center should be assisting you in trying to get Medi-Cal. If you're a regional center client who qualifies for the waiver, they should assist you in getting that. And Medi-Cal should cover those therapies. But the regional center, there may be very, very limited circumstances in which the regional center may cover those if you can prove that it's not available from any other source, but you have to show that you have attempted to get it from other sources. What I would suggest in that case, and maybe Leslie, you can chime in, is I would file a grievance with Kaiser. I would start there because that's who has the primary responsibility for providing that service.
So calling Kaiser and finding out what the process is to appeal, and then following that process and having a great appeal package with support of your Kaiser physician to say, yes, it is medically necessary, and these are the reasons why it's medically necessary, and writing that nice cover letter that makes your child and your case come alive for the reviewer, and having either a Kaiser therapy assessment or investing in an independent assessment, to have an independent practitioner say, here's a treatment plan, and here are goals, and here's what needs to be done. I would say maybe there'd be a better crack at an appeal with Kaiser than an appeal with regional center, or both could be attempted.
What about additional funding for out-of-network providers for OT, PT, and speech, other than any reimbursement available from our private insurance? Will anyone step in and help with funding for out-of-network providers? Lisa, any of those government sources?
Medi-Cal is only going to pay if it's a Medi-Cal provider. If the plan doesn't have the Medi-Cal provider who provides that specific service, you can request that they contract with one, but you can't submit a super bill and get reimbursement. That's just not going to happen. I think for regional center, they would also argue that you have the resources available to you to get those services through Medi-Cal. And so I don't think that they're going to step in unless, again, you have a compelling reason why your insurance or Medi-Cal can't provide those services, because there are no providers for those specialized services.
And if you can make that argument that there's nobody in network who can meet your child's needs, another thing to do would be to make an appeal directly to the insurance company for them to fund more, for them to give in-network reimbursement for out-of-network services. It's kind of a heavy lift. And then even if you get it, it's often takes a lot of time to get those claims processed correctly. But before looking for an alternate source to increase reimbursement beyond the insurance plan, you should really take a careful look at what might be possible directly at the plan. They are required to provide, by law, they're required to provide access to care. So you would want to make an access to care appeal that they need to reimburse you at a higher rate because it's their obligation to provide access to care. And again, it has to be something that is medically necessary and essential rather than a preference of one provider over another.
I do want to jump in though and say one thing about the regional center is that if right now we're talking about medical services, but if you're talking about non-medical therapies like music therapy, art therapy, equestrian therapy, those are things where the funding for that has actually been restored at the regional center. And you can, I don't believe that they do parent reimbursement for that, but if those therapies would help your child meet one of their goals in their IPP, you can request funding from that from the regional center, because your insurance isn't going to pay for music therapy, right? Because they operate on a medical model. But, and well, I don't know, Leslie's maybe they will. But if you're dealing with something that's not medically necessary, but and is considered non-medical, but may help your child meet their goals for their IPP, you may be able to get that covered by the regional center.
Or to reference my face that I made earlier, if it's musical therapy or it is hippotherapy, if the services, the music therapy or horseback services are provided by a provider who is licensed as a service provider under a medical model, if that music therapist is a marriage and family counselor or they're a psychologist, if they have a licensure that's covered with medical insurance, you could use out of network benefits there. And to the other example, if the person who's doing the equestrian therapy has a licensure that is covered, it's hippotherapy, then you could, again, it would be out of network. Likewise, swimming, if it's provided by a licensed OT or PT, it can fall under those benefits. So there's lots of examples there of ways to consider funding.
Thanks for that correction. I appreciate that.
It's very rare that I can add anything to a comment of yours, Lisa. I jumped at that.
No, it's awesome. It's awesome.
Great. Those were perfect examples, Leslie. We had a follow-up question. Can it be considered continuity of care speech since my son has been getting it since he was 2 and he's now 11?
In certain situations, if you have a relationship with a provider where it would be really detrimental to your child to change providers.
Same provider, Lisa, sorry, that information just came in, same provider.
Same provider. So if the issue is that Medi-Cal wants you to switch to someone in the managed care plan, and now I'm not sure how this works with therapy, but for complex medical conditions, if you're working with a doctor and your child is in active treatment for a medical condition, and it would be really detrimental to your child's health to switch providers in the middle of that treatment, you can get some continuity of care coverage where if the doctor and the managed care plan can agree to a rate, that they can do a single case agreement so that you can have that continuity of coverage. I'm not sure how that works with therapy, but that would be a good question to research.
Well, yeah, and Lisa, or I'm sorry, Leslie, there was a follow-up to that. It's for out-of-network provider, and they're looking to get more coverage from private insurance.
Okay.
So I guess, can a parent who has been seeing an out-of-network provider for that long, can it be considered continuity of care for them to get that speech coverage from private insurance? Can you try to get the person in network by using continuity of care if you've seen that out-of-network provider for a long time?
For insurance, continuity of care is sort of like a gap exception. It's about a change of provider. So I kind of want to, and it's a short-term fix. It's saying the insurance is going to pay the old provider for 90 days until you find a new provider. So I want to remove the continuity of care appellation, and I want to maybe get some more clarification to answer the question. If the question is that for the last 9 years, they've had an authorization and they've had sessions, and now for some reason it's ending, the insurance company is no longer wanting to fund it, an argument can be made that this has been essential and nothing has changed and the child still has a level of need. And if you can show progress towards a set goal or do a reeval, then you can move forward based on the fact that there's a history of authorization. But forgive me if that's not an answer to the question that's being asked.
So then we got another question. This is from a mom about early intervention. She said, my insurance has agreed to pay for physical therapy, but all the providers have a 6-month waiting list. My daughter's also a regional center client. So what can I do? Lisa?
So the regional center is, generally speaking, if you have private insurance, the regional center is going to make you exhaust your private insurance resources first. They can provide gap coverage if all of your providers at your insurance have a waiting list. The regional center can step in and should step in to provide that service while you're waiting for your private insurance. And you'll have to provide documentation of the waiting list about how long they expect it to take if there are other providers. But the regional center should be able to step in and provide that service temporarily on the basis that your private insurance is not able to cover it during that period of time.
But the caveat there is that the regional center provider of the services will also not have to have a waiting list, right?
That's true. That's true. We went through that with my daughter with speech therapy because there's just a national shortage of speech therapists. And we had a long waiting list for her for when she was in early intervention. And we went to the regional center and they said, sure, like, here's the list of providers that you can go to. And they all had waiting lists too.
Right.
Yeah.
So one alternative there is again the access to care appeal. I've called every provider that's listed in my network and none of them can do it. I've called 167 people within a 10-mile radius of my home. This is a medically essential service. Here's a prescription. Here's a letter of medical necessity. You need to reimburse me. I have an out-of-network provider who's able to meet my child's need. You must provide access to care. My child cannot be absent. Adequate reimbursement for medically necessary services. It's not my financial responsibility that your network is deficit. I can find the services elsewhere. You must reimburse me at a higher rate. You can try that while you're waiting for a regional center provider to become available. You can maybe work those two avenues at once. But you can tell that I always like a situation where an appeal is possible when it's warranted and when it's substantiated, be it at any of the various funding sources that we're discussing, right? Appeals can be made at Medi-Cal.
We can touch on appeals in a minute, but I wanted to ask sort of a twist to that question, Leslie. So if that same family's insurance will only cover a certain number of PT sessions in a year, right? They say, oh, great, we cover like 25. And the family finds themselves without PT because they've exhausted those 25, sessions. Can they go to regional center and ask for PT sessions until the next year when insurance will pay again?
If it's medically necessary, if they have the documentation to demonstrate that it's medically necessary. I mean, Leslie might have some comments on how to appeal with the private insurance to see if they can allow more sessions if it's medically necessary.
Right. Well,
once you've exhausted your private insurance, then you can go to either Medi-Cal or the regional.
So you would have to exhaust all private insurance options, which can take months sometimes, depending, right? So you have to exhaust all of those before regional center would say, okay.
I mean, yeah, if it were me and I knew that they only covered 25 sessions and I had documentation from the physical therapist and I had already gone to the private insurance and they said, no, this is a hard cap, I would probably take it to the regional center a couple months ahead and say, look, this is medically necessary service. My private insurance has already said, and I've already filed a grievance. They've already said they're only going to cover until June because it's this many visits. Is there any way that we can set up and authorize so that there won't be a gap in coverage? Can you authorize starting in June when those appointments end to provide until the new calendar year? I would approach that in advance if you know kind of when it's going to run out so that you're not scrambling.
And also you can get on a wait list for a provider who might be able to accept the regional center at the same time. You can be proactive in getting on a wait list to get that, because an authorization from regional center or any source is great to have in hand, but it has to be usable. It has to be applicable. And I'll also add this comment that may be helpful to families. There's all sorts of limits at the plan, and it may well be that your plan has a hard cap, that 24 or 30 per calendar year are just a hard cap, and there's no two ways about it. But you should be sure before you start looking for alternate sources, just check or double check that there aren't any exceptions, or by diagnosis, maybe with autism or a complex care, that there's no way to exceed or authorize more or appeal for more. Just double check before you go down an alternate road that you've done all your due diligence and completely understand what's going on at the health plan. And one more tip that I'll offer is if you have an employer-based plan rather than an individually purchased plan, if you have a employer-based plan, you can try to go to the HR department and ask them if they'll make an exception for your child to that 24 or 30 or 50 or whatever it is per calendar year limit, if they can do an extra contractual arrangement for your child. So they go directly to their client where the employer group has bought the insurance and arrange for your child to have a one-time exception for the year to exceed that limit. And you never know what the HR department is going to do for you. If they say no, nothing ventured, nothing gained. But I always say, you don't know who you're going to speak to at that HR department. Maybe they're a parent like we are. Maybe they have a niece and nephew who has a disability. Maybe they're willing to reach out and try to arrange something special. Is it a high probability outcome? No. But it's another way to explore something that may be possible if your family feels comfortable with making that outreach at the provider, at the HR department, at the employer.
I got a call from our private insurance one time denying us, and it was usually you can tell they're uncomfortable, and she almost sounded like she was in tears though, and she said, "I said you're denying like this, and this," and she said, "I'm a parent of a child with disabilities." And she said, "I'm so sorry to make this phone call." Like she was really, she couldn't do anything about it in that moment, but you're right, Leslie, you never know who's going to be on the other end.
And I just want to clarify from my comments about therapies and stuff, that again, that's assuming that the regional center has the next responsibility in line for, so I'm talking about early intervention, primarily that if you've exhausted your primary insurance, because if they're over 3, they're gonna want to refer you to Medi-Cal and the school district.
So I know we're running late on time, and we have, we're running short on time, I should say, and we're getting lots of questions. So quickly though, we did want to touch on some common needs, and we've had some questions about these exact needs. So you can let us know how the funding would work in these situations. Incontinence supplies. Leslie, you want to start that one off?
Sure. So once again, the old mantra comes to bear: private insurance first. So your first step is to contact your health insurance plan and find out if they cover diapers or pull-ups or other supplies under your durable medical equipment, your DME benefit. If they do cover, then you're going to want to grab a prescription from a physician and get on the phone with some of those suppliers and find a supplier who confirm that they still are in network with your plan, and also confirm that they're a Medi-Cal provider. And then, whiz bang boom, you should be all set up with insurance primary and Medi-Cal secondary. Something that I learned from Lisa is that Medi-Cal will fund incontinence supplies for children ages 3 and up if the incontinence is due to their disability. So kudos to you, Lisa. That's something I learned from you. Conversely, if there is no benefit for incontinence supplies on your plan, then you want the person you speak to produce or connect you to someone who can produce a letter that says, incontinence supplies are a non-covered benefit on this program. Then you can take that letter to one of 2 places: to a provider who is a Medi-Cal provider. You can prove that your primary is not going to pay for diapers, and you'll be all set. The caveat is, because there's always a caveat, that the incontinence supplies that your insurance company or Medi-Cal will pay for may not be the brand that you're used to using. And in that case, you can mount an appeal to regional center for the specific brand your child uses, if you have a compelling medical necessity, right? Again, it can't be brand preference. It has to be something that can be promoted as a health and safety issue. So, so it's insurance first. They either will or won't cover. Medi-Cal second. We know the order of operations here. Probably you'll be able to find a provider who will give you incontinence supplies with the combination of insurance and Medi-Cal. But if you want to take that extra step and you feel you have the rationale to get a specific brand covered, then that's an appeal to regional center.
And I just want to add a couple things. The first thing is you're going to need a prescription from the doctor either way. So you've got to get the prescription from the doctor. You might want to do that at the same time that you're checking with your private insurance, because you're going to need, if your private insurance does not cover consumable medical supplies like incontinence supplies, you're going to need the prescription from the doctor and the denial. Another thing I wanted to add is that incontinence supplies, not just diapers and pull-ups, they also will often include, and anything that you're going to have covered has to be in the prescription, and it also has to be in the denial. So if you want to have your doctor write a prescription for diapers or pull-ups, waterproof underpads, barrier cream, they generally will not provide wipes. They may provide cleanser, but they generally will not fund wipes. And I think maybe once or twice a year, they'll cover waterproof mattress covers. All of that has to be in the order from the doctor, and all of it has to be in the denial. So the denials can't just be, we don't cover incontinence supplies, we don't cover diapers, we don't cover chucks, we don't cover barrier cream, we don't cover waterproof mattress covers. And you take that, and so it has to be in the prescription and in the denial, and then you take that to a provider. And again, it has to be somebody who contracts with your specific Medi-Cal plan.
Right. And also in that detailed prescription should also be the quantity and the size,
quantity, quantity and size and why. You may be able to find a provider who offers the brand that you need. The regional center is going to want to see, if you go to the regional center and you say, my child's allergic to the diapers that they send from Medi-Cal, and a lot of our kids have sensitive skin, they have dermatology issues, they come up with a rash with some of the diapers, you're going to need to show not just that they can't use those, but that you've already tried to find a brand that will work and that you can't find one that Medi-Cal will cover. And so you want to ask around to a few different agencies and see if anybody provides. And it's a little bit easier to find that when they're babies, because you like baby diapers are a little bit easier to find. But once those diapers get bigger, it can get really challenging to find a brand that works. And then once you find one that works, you want to stick with it. And if it's not provided by an agency that is contracted with Medi-Cal, then you want to gather your documentation and go to the regional center.
And another compelling piece to put into that overall packet is if you happen to have tried the Medi-Cal or insurance provided diapers and you failed with them, if you have some log of failure, this happened, a rash occurred, we had to go to the doctor with this rash. And you can also use arguments of especially compelling with regional center, that use of those inferior products led to your child not being able to successfully access their community as they would if they had a product that provided more coverage or enabled them to go, out of the house for a longer period of time. Those Medi-Cal diapers can be awful skinny.
Yeah, awful skinny and made out of materials that kids are often quite sensitive to.
Good point.
And Lisa, there was a clarification from Margaret. She said, do children have to be regional center consumers to qualify for incontinence supplies through Medi-Cal? And
No.
She was specifically saying it's a child over 3, not a regional center consumer. They did receive early intervention services.
No, they have to have Medi-Cal to receive it from Medi-Cal.
They do have Medi-Cal coverage.
If they have Medi-Cal coverage, they should be able to get it from Medi-Cal. They might have a more difficult time getting a different brand if their child is not able to use that, but they can always appeal. If they don't have any other way to get those funded, they could appeal and just be like, this, look, like my child can't use these diapers. But no, Medi-Cal and Regional Center are separate agencies, and there are plenty of children who have complex medical needs who are not Regional Center eligible because they don't have significant cognitive impairments, or they don't have one of the diagnoses that is listed or something similar. There are plenty of kids who are very medically complex.
You could use insurance
qualifying.
alone. You could
Yes.
get incontinence supply. If your plan covers incontinence supplies, you can get it from insurance alone, but you'll be subject to a copay or an in-network deductible. So you can take that process and use as many different sources as you care to.
And I'm going to ask one thing, and then I'm going to ask you guys to I'm going to ask you a question that could be in an event in itself that you have to answer in 30 seconds. But really quickly, we did have a question about, Lisa, this one would be for you for Medi-Cal. How difficult is it to get dental added to Medi-Cal?
The Medi-Cal for children includes dental coverage. The challenge is finding a provider that accepts it. Now, the area where it can be really, really important that Medi-Cal includes dental coverage is that sometimes our kids cannot just go to the dentist. Sometimes they need to be sedated for dental procedures, and sometimes that has to happen in a hospital setting. And our insurance our private insurance may or may not cover that, but Medi-Cal should, if it's not covered by your private insurance. And so a lot of the big hospitals, children's hospitals, for example, are able to do dental procedures in a hospital setting where it's supervised by an anesthesiologist, and you should be able to use your Medi-Cal there if your private insurance will not cover that service. Okay. So yes, Medi-Cal automatically for children includes dental coverage.
And it never hurts, and Dental Cal is an interesting example. It never hurts to ask. Sometimes your provider you've been going to, you can discover a way that they are accepting Medi-Cal. No guarantee, but to the Dental Cal point, check with your current dentist. They may not accept Medi-Cal as secondary in their private office setting, but they may have privileges at a hospital setting, and it can be used there. It doesn't have to be a different doctor necessarily at the teaching hospital or the children's hospital. It could be your current dentist does a small portion of their work at one of those settings.
So here's the last question. In 30 seconds or less, but appeals, right? We kind of touched on it, but and I know yours will be a little harder, Lisa, because we're talking about three big things, but in 30 seconds, I don't know, what do you want to say to people about appeals? Because as we know, a lot of parents get there, they're counting on a lot of, whether it's insurance or public benefits, a lot of times they're counting on you not to keep pushing through. What do you want to say? We could say a lot about appeals, but in 30 seconds, Lisa, but what do you want to say to parents about appeals for
Don't be afraid to appeal. Don't be afraid to appeal. If you have documentation that the service is medically necessary, don't be afraid to appeal. Like there's a system set up for due process for a reason. And you have a right to use it. If you feel your child needs that service and you're getting gatekeepers who you feel are being unreasonable, you feel that your child really does qualify for it, that's my advice, is don't be afraid to use that appeal process.
And that goes for Medi-Cal.
That goes for any of the services.
Yep. Leslie?
Well, I would add in a small fraction of people mount appeals, and a surprising number, something like 50 or 60% of appeals are granted. Insurance companies and government benefit sources count on you being demure or going away or thinking you're not entitled. But I would encourage families to make sure they have a solid basis for their appeal, that it's not just something they want or feel their child is entitled to, but something in their benefits and coverage that actually they can key that appeal to make sure they're arguing on the funding source's own terms. Don't appeal on medical necessity if it's not a medical necessity issue. Read the reason you're getting the denial. Look at all those boring pages in the back of your claim and see exactly why it's being denied, and make sure your appeal is responsive to the actual reason why you're being denied. Target your response. That makes a more win, regardless of what the funding source is. That's a more winnable argument when you're talking apples to apples or oranges to oranges.
That's really important advice.
Thank you both so much.
This was
is a
fun.
subject. It's always amazing that there's no way that I could have a conversation with either of you and not learn something, many things in it. So, we know that this is a subject that can be incredibly confusing. And like we said, it's emotional because it's an essential support in our lives and the lives of our children. So to both of you, thank you so much for breaking it down in ways that are easier to understand than, say, my explanation of benefits or the Medi-Cal website. So thanks again to Leslie and Lisa for talking with us today, and to Donna and Iris in the chat, and especially to all of you for stopping by Undivided Live. Have a beautiful weekend.